This conference will now be recorded.
Thank you everyone for being here today, attending the Paradigm Medical webinar on uses of pneumatic compression pumps in various clinical presentations. My name is Jennifer Wang. Jackie, if you don't mind just flipping it to the next slide. I'm the president of Paradigm Medical. We are a national medical products distributor specializing in lymphedema, post-mastectomy, and orthopedic footwear and foot care products. We are the exclusive Canadian distributor of biocompression systems, a Health Canada approved line of pneumatic compression pumps. We've been servicing all of Canada for well over 25 years and are headquartered in Toronto. So I'm very, very excited today to be introducing our speaker, Jackie Mungal. Jackie is the owner of Freedom Massage Clinic, a very impressive clinic based in Barrie, Ontario. So if any of you are in the area, drop by and say hello to Jackie. They specialize in lymphedema, cancer, and therapeutic massage. She has a very extensive training in advanced lymphedema treatments from the Academy of Lymphatic Studies, the Dr. Vawter School, and as well the Kloss Training School. She's been nominated for the Premier Award for Outstanding College Graduates for her impact in her community and has received the RMTAO Certificate of Excellence in Orthopedic Assessment. As you will discover today, Jackie is very passionate about providing informed, ethical, and compassionate treatment and is constantly striving to provide excellence in clinic and home care treatments. I'd like to personally thank Jackie for taking the time today to share her experiences with us. It's been a very trying time, and I know she's extremely busy, so we appreciate you carving the time for us today. A couple little housekeeping things before we get started. If I can ask everyone just to mute their devices, just to eliminate any background noises, which can be distracting. And as well, please save all your questions till the end of the presentation, where we'll open it up for Q&A. There's also a chat function which is available on your right-hand side. There's a little bit of a question box, and you can use that to type in any questions, which we'll address at the end of the presentation. So thank you. So to start, I just want to highlight some of the Canadian statistics. I think it's important for us to be able to put all of this into perspective and to really understand what the prevalences are here in Canada. So in terms of lymphedema and chronic edema, based on a 2017 study performed by Dr. David Keats and Dr. Anna Towers, we're looking at upwards of about 1 million Canadians who live with this condition. So we're looking at big numbers. That's roughly 3% of the Canadian population and 1 in every 30 or so people that you come across in your day-to-day life. How that all breaks out is the majority of the cases are related to venous disease. Although the exact figure is undetermined, we have a greater understanding now that this condition is primarily related to venous disease. Historically, it was thought to be related to cancer, but now we have a deeper understanding of that. About 57% is related to morbid obesity, 15% is cancer related, 8% is related to disability or any chair-bound disability, 4% is related to surgeries that are non-cancer related, and the smallest would be primary at 2%, which are those of us who are born with this genetic condition. In terms of the demographics, we're looking primarily women. Over 70% of the cases are found in women. And the majority is also related to lower extremity, so those in the legs. If you are in Ontario, the figures have been prepared by the Lymphedema Association of Ontario, and they estimate roughly about 400,000 patients live with lymphedema or chronic edema in Ontario. And if you're interested in finding some more information, you can go on the Lymphedema Association of Ontario website. So that just kind of puts things into perspective for all of us. And with that, I will pass it over to Jackie when she can start her presentation.
Great, thank you, Jennifer. You can hear me well?
I can, yes.
Great. So disclaimer, over the next hour, we're going to discuss why and how we at Freedom Massage use pneumatic compression pumps for the treatment of lymphedema, and we are registered massage therapists who are certified lymphedema therapists. Disclosure, FMC, we own biocompression products from Paradigm Medical in our clinic, along with other vendor products for the treatment of lymphedema and orthopedic issues. Otherwise, there are no other disclosures. Why we use pneumatic pumps and the related garments in clinical treatments, what has informed our decisions to use them and how we use them. And then at the end, we're going to cover about 10 examples of real people with compromised lymphatic systems. I'll provide an overview of our treatment approach and the amount of involvement and participation clients are required to take in their treatment, because the success of their lymphatic treatment is based on a partnership. There are many options related to static and dynamic compression based on research, experience, and understanding of the various products available. A few points of consideration when we do talk about compression, and this is coming from Lymphedema, a concise compendium of theory and practice. External compression, when we're talking about that, it complements conservative lymphedema therapy. So that would include hosiery, garments, multi-layer bandaging, adjustment wraps, nighttime garments, pneumatic compression pumps. And compression is not intended to squeeze the fluid out of the limb, but rather to act as a counterforce to muscle activity and thereby generating higher tissue pressures during contraction. Compression provides a powerful stimulus for the lymphatic drainage. Compression also limits the capillary filtration by opposing capillary pressure, and that reduces the swelling from excessive fluid overload. Compression is less effective without exercise and mobility, and the reason for this point is to emphasize that patients should be fully informed that decongestive lymphedema therapy is not a passive form of treatment, but rather an active one that relies on the cooperation of the patient in order to achieve success. And that's why at Freedom Massage, we have been able to consistently demonstrate the role of pneumatic compression pumps as a complement to the treatment of lymphatic pathologies. It all begins with this slide, lymphatic pathogenesis. This graphic illustrates the forces that are impacted by delayed treatment, improper treatment, or incomplete treatment. We believe we need to go to the toolbox and use the most appropriate tools available that will assist in the recovery, repair, and maintenance of lymphatic system. Treatment non-compliance is definitely a problem, and it is detrimental to the entire treatment plan. To this end, it is essential to educate clients on what lymphedema is, what has contributed to the issue, and what we can do as a team for lifelong maintenance. The vast portion of treatment resides with the client. That's self-MLD, compression, and whether that is static and/or dynamic compression. It's exercise, skincare, nutrition, and a healthful lifestyle. When we first meet with the clients, we discuss their health history, diagnostic tests that have been performed and their results, doctor recommendations, previous treatments for lymphedema, surgical procedures, etc. But also social support structures that are in the home and the family, and doing a thorough assessment for lymphedema and the orthopedic related issues. We discuss our approach and give clients the opportunity to think about their role in treatment. Clients need to be educated of the options available and informed in order to give consent for treatment. As therapists, and hopefully there are some therapists on the line here, our role is to seek to best serve our clients' needs. At Freedom Massage, We use various modalities. So we're talking about compression garments and compression pumps today, but we use a large number of modalities to treat whatever the client is presenting with. First off, complete decongestive therapy. Everyone on the line should probably be well aware, but to ensure we are on the same page, it includes skin care, manual lymphatic drainage from CDT or certified lymphedema therapists. It involves compression in various forms and exercise protocols that is essential for results. Even though nutrition and diet play an important role, this aspect of care is outside of our scope of practice as RMTs. Biocompression pumps are used regularly in pre-treatment, as part of treatment, post-treatment, and in between treatments. When we get to the client views at the end, you'll understand what I mean by those. We use them to help reduce fibrosis, increase lymph flow, decrease lymph volume, and reduce pain. We also use compression garments. Properly fitted based on their presentation is essential. It could be adjustment wraps for reducing maintenance. Actually, let's pause for a moment regarding compression garments. Often clients will come with a script from their doctors indicating a dosage pressure of 20 to 30, 30 to 40 millimeters of mercury of pressure, and that's pretty well it. But according to the International Lymphedema and Wound Training Institute, garment selection incorporates the shape of the area, texture of the tissue, refill rate, issues presenting, whether they be wounds, infections, other comorbidities, dosage, and etiology of lymphedema. Often clients will bring their garments in which are not appropriate for how they are presenting. So proper quality compression garments is essential. Again, whether that's a static, such as the garments that we order, or dynamic compression, it's essential to have the right tool for the right reason. We also use laser or low-level laser, and we use that to reduce pain, decrease inflammation, and wound healing in lymphedema. We also use shockwave. It's used to reduce fibrotic tissue, allowing the tissue to become more pliable for MLD. We also use targeted radiofrequency, and that helps to reduce pain related to lymphedema, for example. We want to go to the toolbox to use what is most appropriate for the client, and we want to disrupt this cycle that you see up on the screen. The next slide is going to show why early intervention is so essential. The next two studies you're going to see will illustrate the importance of getting lymph flowing to reduce lymphatic pathologies and their sequelae. This diagram shows the degree of lymphedema severity. It correlates with the amount of structural damage to the lymph collecting vessels. One indicator of the lymphedema is dermal backflow. To understand this staging scale, the authors in the research explain. So we're just going to be looking at this slide going across from left to right. In lymphedema, lymph fluid flows backwards from the superficial lymph collecting vessels to the precollectors and the lymph capillaries in the skin via the efferent precollectors. Valve insufficiency in the superficial lymph collecting vessels and the precollectors cause the reflux of lymph fluid back into the skin, and you can see that as it's going left to right. This is what we call dermal backflow. So the lymph capillaries and the precollectors in the skin are dilated, and in the advanced stages of lymphedema, the superficial lymph collecting vessels deteriorate and disappear. Let me say that again. With the valve insufficiency, the superficial lymph collecting vessels and precollectors, this will cause reflux of lymph fluid into the skin, and that is dermal backflow. They've found that the superficial lymph collecting vessels will actually deteriorate and disappear. And further on, there's some research that actually shows this. Notably, dermal backflow can be seen not only in the lymphatic limbs that we're seeing, but also in the subclinical phase in secondary lymphedema. This means early on in the pathological process, and it's often subclinical before a diagnosis is rendered, damage to the lymphatic system is already mounting. So having a tool, or rather tools available to clients with early intervention to disrupt and interfere with the progression of lymphedema would be advantageous to all. We want to interfere and we want to disrupt the process to keep the lymphatic system as healthful as possible and to stave off further disease processes and get the lymph flowing. We have found that pneumatic compression pumps, with their appropriately fitted garments and proper training and the use of compression garments, whether they be ready to wear, custom, adjustment wraps, nighttime garments, swell spots, they all have a role in the maintenance of chronic lymphedema. The next study will explain why continuous lymph flow is essential. Dr. Scallon presented his research in January of 2020, and he presented it to the Lymphatic Education and Research Network. He explained that acquired lymphedema, the exact cause is not known, but most scientists and physicians agree that it begins with diminished lymph flow. The details of his presentation go way past my pay grade, but as he described in great detail, he found that lymph valve formation is directly dependent on lymph flow. In this slide, he's showing the embryological formation of lymph valves, which is critical for the continual propulsion and prevention of lymph backflow. His studies have shown that in the absence of lymph flow, lymph valves do not form. So how does this impact lymphedema treatment? It rests in his findings that the lymph flow is necessary for the maintenance of lymph valves throughout life. And as we just saw in the last slide, in the advanced stages of lymphedema, the superficial lymph collecting vessels actually deteriorate and disappear. He has shown that not only can you have defects in congenital lymphedema, but also there is evidence for valve defects in cancer-related lymphedema with the reduction of lymph flow. He has shown the effects of reduced lymph flow and valve insufficiency, that it contributes to the damage and the degeneration of lymphatic systems. In this full body lymphoscintigraphy images from left to right, so going left to right here, this is a normal body on the left here. As the images move to the right, you're also able to see that the results of the dermal backflow, because the injections of the fluorescent dye into the lymphatic collecting vessels are traveling backwards into the lymphatic capillaries in the skin, which is why the staining that you see, increased staining as it's going along, that is the dermal backflow that Dr. Scallon is talking about. He's shown that this is due to valves not working properly, or valves that are disintegrating over time and are just not there. What his research is showing is that lymph flow is necessary for lymph valve formation and lymph valve maintenance throughout life. With these studies, Dr. Scallon's ongoing research, he's looking at it from a pharmacological approach. We can still use this information as lymphedema therapists for the early treatment of people. So we need to consider the importance of early intervention and thus education of primary healthcare professionals in early diagnosis and intervention offerings of early treatment, prophylactic education, and compression to maintain healthy lymph flow. This may be a considerable game changer in the impact of early treatment and consistent treatment of lymphedema. The offering of long-term solution of education, self-MLD, exercise, appropriate compression containment garments, pneumatic compression pumps for at-home maintenance to maintain and improve lymph flow. These are all essential. There are many research articles demonstrating increased lymph flow velocity with a decreased time between pulses, therefore increases lymphangial motoricity of the lymphatic system. This has been demonstrated in real time with near-infrared fluorescent lymphatic imaging technology, and we'll get to those shortly. Contrary to previous concepts of Starling's law, we now know that there is no reabsorption of interstitial fluid back into the venous end of the blood capillaries, and only a diminishing fluid filtration across the capillaries. All interstitial fluid, that's 100%, is reabsorbed by the lymphatic capillaries alone. And consequently, all edemas are on a lymphedema continuum and represent relative lymphedema or lymphatic failure or insufficiency. This is key information that emphasizes that there's the importance of engagement of our lymphatic system to prevent further lymphatic pathogenic issues. Therefore, at Freedom Massage, we've chosen to use static and dynamic compression, such as the biocompression pumps and garments, to aid in that lymph flow. This diagram is from the STRIDE Professional Guide to Compression Garments Selection for Lower Extremities. It's from the Journal of Wound Care from 2019. In this diagram, it's showing that the bottom arrow left to right illustrates that each individual falls somewhere between fully optimized lymphatic system, where the lymphatic vasculature is perfect in form and function, versus a poorly optimized lymphatic system where there's some type of underlying congenital dysfunction or mechanical insufficiency or failure. The arrow to the left, pointing from bottom to the top, illustrates an increasing number of demands on the lymphatic system due to comorbidities and risk factors. The more demands on the lymphatic system and the less optimized the system is, the more likely it will progress in the severity of chronic inflammation.
All right, Ron, no, I'm asking you.
Oh, no, it doesn't matter to me. You know, I'm up for anything, so
Okay.
it doesn't matter.
Okay, I'll continue. As we saw in the previous slide regarding the impact of the lymphatic system, patency, dermal backflow, and lymphatic contractility are all concepts that we need to be very much aware of. What the research is showing is that all edema is technically lymphedema, albeit stemming from different underlying etiologies of diagnosis. Past definitions of lymphedema need to be replaced by the new evidence and broader definitions. So clinically, all comorbidities leading to some form of edema, swelling, even after orthopedic injuries, infections, is an impact to the lymphatic system, and we need to treat it in light of a lymphedema therapy approach. From this research article, they summarize that it may be better to consider the presence of chronic edema as synonymous with the presence of lymphedema, in so much that all edema represents lymph drainage failure. So in agreement. We agree that lymphedema is a much broader term than the traditional definition, and we have found that the use of lymphedema therapy and pneumatic compression pumps, using those for many issues, as we will see later on in the client profiles, is consistent with the findings here. In this article, Mortimer found that there was significant impact on the reduction of disease symptoms and manifestations with the use of compression pumps. We often use the term evidence-based treatment, and this is why I'm bringing a lot of the science behind why we at Freedom Massage have chosen to use pneumatic pumps. So we use this term evidence-based treatment. In our clinic, we use the term evidence-informed, and I'll explain why. Evidence-based treatment is the integration of research evidence, clinical experience and expertise, and client values, and is the basis of evidence-based medicine or treatment that was proposed by David Sackett. Evidence-based treatment is being challenged. This principle is being challenged due to randomized controlled trials, although most rigorous, hopefully. There are too few and they're costly, and therefore industry and manufacturers have a heavy involvement in the research grants. And this may raise questions on their validity. This is the crux and the challenge when viewing the research. And to this evidence, the author of this article is saying that evidence-based medicine has been hijacked. So, evidence and guidelines to provide information on clinical care, This can come from many sources and case studies. Although not considered rigorous science, it provides accounts of treatment. And if this information is shared, we could take enormous steps towards improving lymphedema therapy offerings. This is the purpose of this webinar, to open dialogue on options. To expand on this point is an example from the Oncology Research Summit from 2018. One of the keynote speakers asked the questions of the attendees, and those were primarily for massage therapists in the audience. They asked the question, who is treating clients with chemo-induced peripheral neuropathy? 80% raised their hands. And the presenter said there were 2 records available of treatment by massage therapists as case studies treating chemo-induced neuropathy. So she challenged the participants to start to record outcomes and case studies to garner attention to treatment options and efficacy of treatment versus simple opinion, or to wait for science to catch up, as it were, to open our doors to give witness to what is taking place in clinics and hospitals around the world. Okay. Sorry, there we go. With this in mind, there are lots of research articles to sift through, showing quality results, some conflicting results using different methodologies, various accounts of how much pressure should be used for compression pumps to be effective. Some articles are 20 years old, while the technology today is much improved and much more adaptable to each person. Some researchers speak conclusively about the efficiency and efficacy of pneumatic compression pumps, while others show minimal difference between CDT and CDT with compression pumps. But a point here is that they do show improvement, and the question is whether it is significant enough. On this point, it's important to note that there are many other considerations beside just absolute lymph volume reduction, but also lymphedema-related sequelae like cellulitis, surgical wound management, sepsis, pain control. And there are factors of quality of life, ADLs, mobility, range of movement, BMI and obesity levels, convenience and availability, customized options to taking control of their own treatment, and early and prolonged treatment options, and cost considerations. Details from these studies have found that I'm going to be saying PCTs a lot. Those are pneumatic compression therapy devices. PCTs provide significant edema reduction and long-term maintenance. They can provide treatment equivalent to in-clinic methods, can maintain edema reduction even after discharge, can reduce the incidence of cellulitis infection. Conclusion of PCT use can be potentially significant in the difference for lymphedema treatment when clinics or clinically trained therapists are not available. The problem, though, the adoption of these systems by clinicians has been limited. Why? Because visible evidence of the efficacy of PCTs to stimulate lymph uptake, propulsion, and movement, including transporter proteins in lymph fluids, has been deemed lacking or inconclusive, and by opinion in the literature that PCTs do not stimulate lymphatic transport. This challenge was part of some research from 2017 that looked specifically at this claim. The lymphoscintigraphy study demonstrated tracer uptake using fluorescent dye by the lymphatic system during a pneumatic compression treatment. Lymphoscintigraphy is a special type of nuclear medicine imaging that provides pictures of the lymphatic system real time, which transports fluids through your immune system. And it's often used, you may be aware of that, to identify sentinel lymph nodes or the first lymph node to receive lymph drainage from a tumor. This study provides evidence that PCT, or pneumatic compression therapy, may facilitate lymph vessel uptake and transport. as well as from distal to proximal movement. If you see on the left here, the velocity rate before, during, and after, and then the time between each pulse, before, during, and after, you can see a significant change in the lymphatic system. It wasn't just the flow, it was also vessel recruitment that was seen. How they did this is that they used 2 completely clear leg garments during the PCT, allowing a quantifiable view of the lymphatic pumping velocity and frequencies before, during, and after pneumatic compression therapy. They were able to demonstrate live, real time, the increased flow of lymph with the near infrared fluorescent lymphatic imaging. Lymph pumping, they found, is effective by opening and closing of one-way valves inside the lymph vessels, which respond to changes in the hydraulic pressure. That's why the pump was used for this. Again, a lot of studies here. These 2 studies looked at pneumatic compression therapy, and they found that the rate of propulsion increased during and post-treatment as compared to pre-treatment, showing improvements in the rate of lymph propulsion as well as vessel recruitment. Lymphatic function improved in all the subjects. In this diagram here, this is what they actually see. So I hope the arrow doesn't confuse you. It's not going in that direction. They're just showing direction of where the elbow is, and this is the direction that the lymph is actually flowing. So this is before, where you see how much lymph is flowing through, and then afterwards, you're seeing an increased flow of lymphs by vessel recruitment. Standard management of lymphedema is the use of complete decongestive therapy. Again, that includes manual lymphedema, or manual lymphatic drainage, compression bandages, therapeutic exercise, and skincare. But the lack of patient clients with prescribed self-MLD therapy is a major cause of treatment failure. And so the question is there an alternative? In the text, Lymphedema, a Concise Compendium of Theory and Practice, they have indicated that the key to achieving a successful long-term results from decongestive lymphedema therapy is to promote self-management and to empower the patient to comply with the cornerstones of treatment. The lymphedema physicians and therapists should encourage patients to take control of their condition and learn when to ask for support. In this randomized controlled trial, they show the results indicating, once again, the value of progressive or pneumatic compression therapy. And all of the information available is just repeating the same information. So I'm going to go ahead to the next slide. What the author of this research is saying is that ultimately it is necessary for the patient to attempt to maintain the gains and manage this lifelong condition in a home setting. Successful transfer to the home setting is challenging, and many patients find the procedures, particularly those of self-MLD and bandaging, not only time-consuming, but difficult to carry out, especially if they have physical limitations from comorbidities. Poor patient adherence to prescribed home treatment can result in the failure of maintained progress. In this randomized controlled trial, Group 1 received CDT, lymphedema treatment, and that includes compression, and Group 2 received CDT and the pneumatic compression therapy. Both saw significant improvements. The conclusion seemed a little different, but I'm going to read that out. Our results showed that pneumatic compression pumps do not have additional effect of reducing lymphedema. Although we did not find any statistical significant difference in the reduction of lymphedema between the 2 groups, the numerically larger reductions were observed in Group 2. So they're not denying that there was change, it's just that is it significant enough? In this study, although it is a small group of only 23 patients, they found a significant, well, 43%, 45.3% improvement with decongestive therapy with using a pneumatic pump. Other aspects to consider here is that it was well tolerated. So very little adverse effects, and they did see an improvement. So what they're suggesting is that using a pump will provide an enhancement to the therapeutic responses, and that's what we want to achieve as therapists and for the patients actually receiving this. In here, just the highlights there, is 86% of the patients, because we're not just looking at lymph volume change. They found a reduction in the skin hardening and fibrosis. When you reduce that, you're able to do the MLD much more effectively. 85% demonstrated an increase in their ability to do their activities of daily living, increase in range of movement. Other research that I've looked at saw that not only the changes in the volume, but also an improvement in their overall quality of life. And that's what we want to look at. ADLs and improved quality of life, reduction of hospital visits. These are just, and I believe you all have slides there, just showing the improvements, having the treatment at home, improvement in the ADLs, and the reduction in pain. Again, more studies, but these ones are indicating something that I think we have to definitely be aware of. No clear guidelines on compression levels and frequency emerge from the literature. And that is something that we need to look at as therapists and open our doors to this, because various clinics are using the compression. What is the best practice that we should be implementing in our clinics? And having that open dialogue, I believe, will aid us in that. And there are no consensus on the frequency or treatment parameters as far as showing what is best practice. Non-compliance. So non-compliance to treatment, ineffective self-MLD, and wearing appropriate compression garments. This is essential. So often, as I indicated earlier, people will be coming into the clinic with the garments that have been prescribed, or that they've gone on Amazon, or they have in their hands, in their possession, some garments, and it's not doing what they need to have done. So compression garment efficacy, we definitely need to do better on that. Just pass through here. So in this article, they have indicated that there are known limitations for sure. Therefore, we need to look at other options, other tools that should treat lymphedema in clinic settings as well as the home setting. And owing that PCT's benefit include a proactive pressure control, high venous return, and sustained effect, and enhanced personalized treatment efficiency, we need to consider pneumatic compression in our treatment options. So now we go into looking at some of the people that we have been treating. There's lots more to go, but just hang in there. And if you have any questions, please, we'll take them at the end. So as we go through the examples of real people we have treated at Freedom Massage, please note that we work on the understanding that all edema is on the continuum of lymphedema. And this will be made clear based on the clients and what they're presenting with. Also, as I said way earlier on, that biocompression pumps are one of many modalities utilized in our clinic, and no two treatments are identical. Some very similar protocols are followed, but all treatments are tailored to the client's presentation, and this includes proper education and active involvement in the client's daily care. So, this first person who came, the original reason for her coming was orthopedic surgery. Both knees were done, so full knee replacement. and she had the need for gait correction. So her treatment included massage, shockwave, targeted radiofrequency, bowel compression, and the use of previously prescribed compression garments over top of the use of Duralast short stretch bandages. Several treatments and home care, and then she was discharged. Bowel compression was used in this form as an orthopedic treatment to help reduce the fibrotic tissue, the thickness that she referred to around and proximal to the knees, and also the lymphedema in a broader sense of the term lymphedema. She was doing very well until 6 months later, when she presented with full bilateral lymphedema, pitting edema, fibrosis. The skin was firm and tight, and it was during the summer. She was distraught, actually devastated, and defeated. Those are her specific words. So how we use this. And the lymphedema, we believe, was post cervical cancer treatment, which included the surgery, chemo, and radiation. So we started with 20 minutes to prepare the legs for MLD, full bilateral treatment with immediate compression and bandaging afterwards. We saw her the next day. So often we will use the term rapid fire, and I'll explain that more in the next client. Rapid fire, we saw her next day and did this treatment one more time. She had in total 4 treatments and was recommended for flat net because she is another example of somebody who came in with a 20 to 30 prescription of circular net, which was not fitted well, and clearly with what she was presenting with needed a flat net option. She did prefer to have the adjustment wraps, but she wanted also to have a circular net option for when she goes out. Because again, in her words, her legs were normal looking and pretty. So she wanted that look going forward. Why I say this is that compression is on a huge spectrum, and we need to consider quality of life and how can we meet the needs of each client based on what they're looking for. An interesting point here is that this client, she received the compression treatment in clinic, and so she thought she could follow up with that, and she purchased one from Amazon. That was not a good decision, and it actually caused problems for her. So maybe that will address some of the concerns that people have. A properly fitted garment is essential for treatment. So update on her. She is fully able to use self-MLD. She has an exercise program. She is using her compression garments along with coming in for monthly treatments, as she says, her checkup points. During this time, she did gain some weight, and because of her increased mobility, she's very pleased with not only her weight, but her overall movement, range of movement in her knees as well. She's an example of one who, when fitted with the proper garments, both static and dynamic, she can do very well. Client 2. This is an example of someone who struggled for decades without treatment. This is an amazing client, and we could take a whole hour to discuss her situation. Incredible results, but if there were a perfect example that could demonstrate what a pneumatic compression pump was able to do, this is the case. So that's why I wanted it earlier on. At our clinic, we use the SC3008DL sequential circulatory pneumatic pump and the garments. So just so you know which one, in case somebody has a question, which one we're using. She has advanced lymphedema. Treatment included bowel compression. It was bilateral, but the left leg was our primary focus. So left leg was primary focus, while we're using the bowel compression on the left while I'm treating the right leg with CDT. Once it's treated and then bandaged, I then go ahead and work on the other leg. So the first treatment, it was back in February, and the treatment included skin care, cleaning, lotion. The client has very sensitive skin, and she had to bring in her own. Manual lymphatic drainage, trunk clearing, biocompression to the left leg, manual lymphatic drainage post pump of the leg and trunk, skincare again, multi-layer bandaging with foam to assist with fibrotic tissue and to support the bandaging with the lobes. Exercise prescription, and we also used Coresia in this case with short stretch bandaging for self-care in between treatments. The treatment for this amazing lady was 8 treatments until she was discharged, with the recommendation of a purchase of another kind of compression, adjustable wraps, bilateral. And again, you can choose from Juzel, Medi, Jobs, Ready Wrap. There's so many to choose from. And through the ADP program, we also recommended that she purchase a biocompression for her daily maintenance. So her exercise program and all of this compression made her able to get on with her life. So I just wanted to point out what I meant by Coresia. In between treatments, she was not comfortable with the multi-layer bandaging. So this was a way of getting her to continue with the treatment when she wasn't at the clinic. So this one is showing when she came in, that's what she looks like, and then we unwrap it and then work the leg. So this is what on the right here, this is what she came in with. 8 treatments later, this is her leg, okay? Next person. So again, we treat lymphedema on the continuum of lymphedema that we spoke about. The symptoms for this gentleman began due to months of very little movement and increased swelling in the left leg and really minimal in the right. Overall, he required minimal intervention and a recommendation of a safe home exercise program in the seated position because of his Parkinson's. This is an example of how an early intervention could have improved his quality of life and physical rehabilitation if prescribed with a lymphedema treatment. So he happened to hear from a neighbor about lymphedema treatments at our clinic, and he had no other option, according to him, and he was very pleased with the comfort of the pneumatic compression, and the results after one treatment sold him on it to return for a follow-up. So the biocompression, with this gentleman, we used what we term a pre-treatment. There is a pre-treatment function in the model that we have. So we did the pre-treatment of compression, followed by lymphatic drainage. And for this gentleman, he's a senior, we once again suggested a Coresia with wrap because it wasn't possible for him to use the multi-layer bandaging. An adjustment wrap would have been a great option as well, but this is after the first treatment. I sent him home with the Coresia on. He responded so well that 3 treatments later, he was discharged. Unfortunately, he did fall again, a Parkinson-related issue. We had a couple more treatments and once again discharged. In this case of secondary lymphedema, bilateral mastectomy, bilateral lymph nodes removed, reconstruction, surgical complications, obesity, bilateral arm lymphedema, and bilateral truncal lymphedema. The treatment options for this person, it was difficult. I come right to the non-compliance. We had a discussion at the very beginning that this is the way we treat, and involvement of the client is essential on a day-to-day basis. This is an example where she required day and nighttime compression. And this is an example where we were not as successful as I would like to see. But treatment included this. It was using an arm garment with the chest, followed by lymphedema treatment, and she didn't want the multi-layer bandaging, but only use what she came in with as far as her purchase of a garment. So good things came from this is her exercise protocol, teaching the truncal MLD, that was important. But this is a case where she would have really benefited from having a pump solution in her daily life. The reason that that was not part of her life was recommendations from a therapist suggesting not to use a pump. So I know that's going to raise some questions. I'm going to move on to the next one so we can get to question time. Secondary lymphedema. Yes. So MLD, unilateral upper extremity with mild unilateral truncal lymphedema. The treatment here, why I show this picture is when this woman comes in, we keep that arm bandaged exactly like that, and then we put the garment on. We have that compression, and then we put our biocompression on there. And we have found that that is an enormous plus to our treatment. Okay. So the treatment here, because of the amount of lymphedema, we follow through full CDT, and when she leaves, that's what she's looking like. In between treatments, once again, we suggested an adjustment wrap. This was where she was coming from out of town for treatments, and we felt once again, we recommended the use of a biocompression in her hometown to get that there so that she can access her treatment every single day. This is an example where if there is not a clinic nearby with trained lymphedema therapists, we need to have an offering to clients so that they can take care of themselves. Number 6. This is a wonderful example of an early use of pneumatic compression garment. So the referrals that most of the referrals we receive are from surgeons nearby. And this surgeon said, you know, I want you to go there and have early treatment. So I call this a prophylactic right treatment. And she received pre-treatment, 20 minutes, MLD with the neck and truncal clearing, left arm and breast treatment. No compression garment was needed as the client was fitted for an arm garment, 23 milligrams of mercury pressure, for preventative measures when she's exercising, and the use of swell spots for her left breast. The emphasis of this case is really about early intervention from her oncology surgeon and the early education for self-care and monitoring. This is where we're moving into the continuum of lymphedema. In this case, it was an elbow injury, full dislocation. After surgery, she still had difficulties following physio with range of movement. But why she came to us was the amount of discomfort in her entire arm and affecting everything in her life. So biocompression was used for 30 minutes, followed by MLD, low-level laser, followed by the use of Duralast, again a short stretch bandage, to help maintain the compression, but not prevent movement of the range of movement of the elbow. The client did not want to be seen in full compression bandaging or a compression garment because it was too hard to put on. An adjustment wrap was not recommended as a resolution because we expected the lymphedema would be pretty well finished within several treatments. So the client was seen Monday, Wednesday, Friday, and again, that's what we refer to as rapid fire treatment. So Monday, Wednesday, Friday with lymphedema treatment, and then she also came in between those treatments Tuesday and Thursday with biocompression and laser only. We would rebandage her arm and send her back on her lunch hour. She returned the following Monday for final treatment, and she's discharged. This is an example of the pump that we are using. In this case, with the truncal lymphedema, we wanted to make sure that we were addressing the flow into the axillary region. So the biocompression was using the arm shoulder garment, pre-treatment of 30 minutes, followed by MLD, multi-layer bandaging, and in the early stage, Caresia for home, followed by self-bandaging. And then down the road, she was fitted for a compression garment. early intervention. She comes in for support as needed. I'm just moving along because I see our time is rapidly going along. So chronic bilateral knee post-exercise. So multiple arthroscopic knee surgery, bilateral AC reconstruction, movement restrictions post-exercise, and when seated for long periods of time. So this is another orthopedic issue from 3 knee surgeries, and the use of biocompression for 20 minutes post-exercise with cold packs in those units. And the reason for this is all about quality of life. I can speak personally about this because this is me. I use this after exercise in order to keep my knees as healthy as possible and to prevent or delay my knee replacement. This is another example of an orthopedic issue, and this particular person is waiting for surgery. And because of the COVID issue, we are waiting a little longer. 20 minutes of biocompression with cold packs, followed by massage treatment of quads, hamstrings, gentle active range of movement, use of laser. We followed the treatment with biocompression 10 minutes and low-level laser once again. And she was fitted or bandaged with Porelast bandaging for compression, but to not restrict her range of movement. And the client is actively doing prehab with the use of the pneumatic compression therapy and exercise. I just quickly threw this in because we use it in injury recovery all the time to help the blood flow, reduce the dermal backflow for various injuries that we see. So I think we've covered it. The goal here is having a client-centric, effective treatments. And sometimes that means that we need to break the mold of standard treatments. We have to really think outside of the box. And that may mean that we have to have other options available that need to fit how the client is presenting. And we have found effectively, repeatedly, pneumatic compression devices have an important role in our treatment. Research is out there, but we really do need some more rigorous research. But we have a role as therapists that we can be providing our stories, our cases out to other people so that we can have an open dialogue. And I think we're finished. Whew.
So just quickly before we get into Q&A, thank you, Jackie. If you're a patient and you're interested to learn about next steps and whether or not a biocompression system is right for you, firstly, you need to speak with your medical practitioner to determine if this is the right product for you. These are Class 2 medical devices, which are approved by Health Canada. So you will require a prescription to purchase it for home use. From there, you can contact an authorized local dealer. If you are not familiar with a local dealer, feel free to call Paradigm directly, and we're happy to provide you with a list. And then your local dealer would really be your guide to help you select the right device, measure, size, and fit the right garment. As Jackie had mentioned, it's critical to make sure you get the right garment and the right fit to make sure you maximize the efficacy of your treatment, and as well to provide you with training so you're fully comfortable and knowledgeable about how to use the product at home. And then as well, if you have any insurance questions, these products are widely covered by private insurance plans. And as well, depending on which province that you live in, there may be provincial funding available. For example, if you live in Ontario or in Saskatchewan, there is coverage through ADP or SAIL. Next slide, please, Jackie. If you are a lymphedema specialist or therapist and you're interested to learn more, at Paradigm Medical, we provide a certificate training program, which is free of charge, on pneumatic compression therapy. This composes of 2 parts. One is an online training program, and then the second part would be a demonstration where we would send you a pneumatic compression pump and we will walk you through how to use it over the phone or over video conferencing. And then from there, you can decide whether or not you want to become an authorized dealer. If you're not interested in becoming a dealer and you would just like to refer to a local dealer, give us a call, and we can provide you with a list. And as always, if there's any questions that you have, whether it be sizing, garments, measuring, or any contraindications that you might be concerned about, we're always here to support you. So don't hesitate to reach out. And with that, I think we should open it up for Q&A. Please, Jackie is a wealth of knowledge, so any questions that you have, let's field them right now. There is a chat option, so there's a little dialog box on the top right-hand corner. So if you want to use that to ask any questions. Or if you prefer to unmute yourself, then you can just ask any questions through your microphone.
There is a question there on ADP. Jen, if you can respond to that.
Yeah, so I don't see it on my end. Can you just let me know what the question is?
Sure.
Oh, here we go. Yeah, so Doreen, we will, if you can just follow up with us after, we can give you an authorized dealer in Brantford. We're happy to just send us an email. On the next slide, there's all our contact information. You can either reach out to Gleason or Svetlana, who are the lymphedema experts at Paradigm. They'll be able to provide you with that contact information.
Hi, this is Dana in Cranbrook, BC.
Hi, Dana.
Hi. Have you seen this type of therapy work for people who have any of the autoimmune arthritic diseases? Like rheumatoid, for rheumatoid arthritis, we have some clients who have extreme swelling in their lower extremities because of this. And it's making it difficult for them to exercise because of all of the swelling. And I'm sorry, did you say you have seen it work for that?
So I have definitely worked with that. But again, the biocompression is one component of it. We also use the laser with that specifically.
Okay, because we're in a very small community in BC. So we have one rheumatoid specialist, and we don't have lots. We have some massage therapy, but definitely not based on what I'm hearing from you to the same degree. There's no clinics out here that sort of seem to do what you're talking about.
Right. So registered massage therapist, you need to get somebody who is certified in lymphedema.
Right.
It's not, yeah, for sure.
Okay, so you would recommend that that the client go to the massage therapist that has the lymphedema training, go and see them with regard to the swelling that you're getting from the arthritis?
Yes. So again, you need to know the full health history, do the full assessment of the person, and
Okay.
look at any comorbidities as well. Yes.
Okay, thank you.
We also have a question from Rose. Can you put the pump on yourself, or should it be used only with supervision?
Hi, Rose. I put it on myself for both legs. Now I do know how to use it. You shouldn't be using it until you are trained on how to use it. And when you work with your therapist, you would be taught how to modify it for your needs, how to use it, and when to use it. So the answer is yes, you can use it for yourself with the proper training. You're welcome.
I just have another question. I'm having problems sending them to you for some reason. It's Dana again. Have you, is there a prescription available for the pump that we can provide to clients when they're talking to their physicians? Typically, we get a lot of scripts from physicians in our area, and they always seem to think that lower compression is better. So lots of times I'm phoning them back, helping them understand, you know, especially for the flat knit garments for people with lymphedema. When you have the prescription for the pump, does it also, would you also get stated on there the level of compression that you're applying?
Jennifer, are you answering or shall I?
You can answer that. I don't, we typically, we have like general protocols that we would recommend, and we can provide that information for you. But if there's any nuances aside from that, that's something I think, Jackie, you might be better to address.
So there are some standard protocols available. You need to have it modified to that person because comfort is important. There's a lot of research out there with the issue of how much pressure is the most effective pressure, and especially with using the pump. Some people are using it, 70 to 100. Okay, others are using it in a much lower dosage. It really depends on understanding what the pump is doing. Again, history of the client, what they're presenting with, and working with them directly to make sure that it is not only comfortable, because comfortable at a too low of a dosage won't be effective. So comfortable and effective, and then having the proper compression garment post-treatment.
Rose had another question about, should you do self-lymphatic drainage after the pump use?
I'm going to say a big yes on that one. Reason why is you are complementing the prescription that your certified lymphedema therapist has given you, and self-MLD is a part of that. So this complements what you are already doing, just like having effective compression garments, whether it be just for day use or day and night.
So we have a question from Tanya. I'm a certified fitter and new to compression garments for lymphedema. I'm still learning. Please invite me to any education sessions on compression garments and how to assess and provide appropriate garments. Thank you. Okay, not a question.
Just a comment to you, Tanya. I would suggest that you Google Stride, STRIDE, and it is a great resource for compression garments because it is not just the dosage that we're looking at.
I have a question for Jackie.
Yes?
Jackie, this is Doreen.
Hi, Doreen.
Okay. Per my previous note, you can see I'm very compliant trying to manage my lymphedema, which is in both legs. I go for my decompression therapy with a therapist here in this area when it's available to me, but she's not yet open again because of COVID. I wear my stockings compliantly every day, even in 90-degree weather. I use Carisi at nighttime. And I also am trying to be even more active by learning to use Nordic walking poles. And I am very, very interested in the pneumatic pumps. But I'm just wondering, does it make sense to me if I can get a trial through a rental company or something before I purchase?
I think it's important to know your presentation. What is all going on in your body? What's the cause of your lymphedema? Where are you as far as your mobility, that type of thing? So I would say, working with your therapist right now, you need to work with your therapist to make that decision.
Okay. I have been through a great deal of tests at the hospital, and they tell me they don't know why I have lymphedema, especially in both legs. I did have surgery on my right leg when I was only 14, and it is worse than the left, but they both swell. And like I said, I'm doing everything I can possible to manage it. So I will contact my therapist and see what direction she would like to send me in then.
And this is a certified lymphedema therapist?
Yes.
Okay.
Great. Beth had a question about are the pumps ADP covered? And I can help answer that. So yes, the pump is covered through ADP in Ontario for primary candidates only at this time. You will need to speak with your physician because you need to get an ADP authorizer to evaluate you and to provide authorization for you to apply through the ADP program. So Beth, I hope that answers your question. Yes, so primary only. So primary candidates only at this time. You might want to look at if you do have private health insurance. Most private health insurances do provide coverage if you have a prescription deeming that it's medically necessary. The coverage ranges vastly, and it's really dependent upon your personal coverage. So we've seen anything from $2,000 to upwards of, there's no limit, so well over $10,000 in excess. So it really varies quite dramatically. So speak with your private insurance. Anna, if you send us an email, we can provide you with the ADP authorizers available in the GTA. I do have a list of those individuals. So send us an email and we can follow up with you so you have that information. And Rose had a question. So Paradigm is located in Toronto. We're located at 19 Waterman Avenue. If you go onto our website at www.paradigmmed.com, you'll be able to grab our address. So we're based in East York, just southeast of the Don Valley Parkway and Eglinton, or sorry, the Eglinton, yes. So yes, everyone, the slides we've included in the email that we had sent everyone with the dial-in information. We'll also send it out again too as well, so everyone has it. We also are recording this presentation so we can make it available for everyone after the fact if you want to, go through it again on your own.
Wow.
So last call, any other questions? Okay, wonderful. So let's wrap it up from here. Thank you everyone for attending. We know it's a super busy time and we appreciate you guys taking the time to learn more. Thank you again, Jackie. I know you've been very busy scrambling to reopen your practice. And as always, if there's any other questions, don't hesitate to reach out to us at Paradigm directly. All our contact information is available on the slides. We have a contact us page, or visit our website, or you have Svetlana's email, just send her an email and we will respond to you in a timely fashion. So thank you everyone and have a wonderful, wonderful day. Take care.